le futur du monde, la technologie, for my French speakers,
Oui.
the period tracker to tell you if you're pregnant or not. And
Well, they don't just do that.
Why did you say that? If digital health is the future, that's what we're going to use, making it accessible and equitable for everyone.
There should be informed consent, because it's not like you can just do whatever you want with someone's data and you
Right.
can just assume that they'll be okay with it.
Hello, Globies. Welcome to the World Health Investigation Podcast. My name is Loza.
I'm Jocelyn.
And I'm Edna.
We are three young global health professionals and your hosts for the World Health Investigation Podcast.
Also known as WHI, we'll be discussing all things global health and unpacking the most controversial health and social issues,
as well as promoting new wave global health development and equity.
So, ladies, what's the tea in global health today?
Today's tea,
Mm-hmm.
speaking of tea, it's more about tech.
Ooh.
technology.
Heck.
Le futur du monde, la technologie, for my French speakers.
Oui, baguette. Okay.
Right. So we're talking about digital health. Like, the big question is digital healthcare the future?
Ooh, that's a big question, you know.
Let's unpack.
Is digital healthcare the future? So we've seen different examples of digital healthcare. I'm pretty sure if you don't know, there's so many ways that I'm sure one of you or all of us have used digital healthcare. Like, let's say the NHS app, track and trace.
Yeah.
Pardon?
Sorry.
You have something to say?
Oh, it's energy, negative energy.
Ma'am.
No, both of you turn nothing.
It's just NHS track and trace.
I just want to know, like, if you have something to say, because that's my case study, like NHS track and trace. We're going to talk about how, during the pandemic, NHS track and trace, right, was used during the pandemic to track COVID-19 cases and inform people to self-isolate.
It did
do that.
And
sounding very convincing to me right now. You have to say, like, just say it.
Just remember, people turning theirs off.
Yeah,
they don't get tracked and traced.
Exactly. I just remember it's not even being a requirement, and therefore it's like, what was the point?
Yeah, you'd go to a restaurant, they'll say, do you want to be tracked? No, okay.
Yeah, so sure, it was used. That is true. I guess. Carry on.
So my point is, it was still used. People just chose not to use it, right?
Yeah.
But yeah, obviously, like, we've seen different cases. We've seen different apps that have been used, like in mHealth, particularly like mobile health. We've seen like the sleeping app, the sleep reminder for you to go to bed. We've even seen screen time could be considered something like digital health. We've seen
period trackers.
Period trackers. That's
the period tracker to tell you if you're pregnant or not. And
well, they don't just do that.
Why did you say that?
What the hell?
I have to be blunt.
Did you see that man that tweeted saying, like, women that have a period tracker, he was slut shaming them basically? So the only reason you would have it is just to make sure you don't get pregnant. And I was like,
what?
Once again, our life revolves around men. Is it not just for my own health? Anyways, yeah, that was a tweet.
It is to track your... Why am I even justifying?
Exactly.
This is me explaining myself. But for those of you who don't know, the period tracker helps you track your time of the month to check even like any symptoms. There are things like polycystic ovarian syndrome, like if you're having some heavy menstrual bleeding or headaches or whatever, or symptoms.
You're missing months, you have to track why that is.
Exactly.
Our body needs to be on a cycle, and we need to make sure we're on top of it. Yep.
Yeah.
How long your cycle is.
So like we've seen a period tracker. We've also seen there's also like the medical information thing for like emergency information. You can put in case something happens to you. So we've seen good uses of digital health. So please do not come for my digital health people. Okay. I was just saying. Yeah. Anyways, the problem now is that worldwide, models of health and care are struggling to meet the challenge of the aging population. We've seen in a lot of like developed countries, there's an aging population, right? And digital health and care interventions are recognized as key to the solution in tackling this crisis using modern technologies and digital services. And not only do they change the way we communicate, but they also offer like more innovative ways for monitoring our health and well-being, as well as providing greater access to personal data and self-management. And then it also empowers like a patient. It empowers us to track, manage, and improve our health and care environments, leading to greater independence and improved health outcomes. So by innovating, we can reduce inefficiencies in health and service delivery, improve access, reduce costs, increase quality of care, make health services more and more person-centered, and also like personalized medicine for patients' unique needs. So there are so many benefits of digital healthcare.
Digital health.
It's so many benefits of digital health. So even the WHO there was a World Health Assembly where they recommended countries and stakeholders to have that urge to make direct efforts towards creating consistent e-health vision in line with the country's health priorities and resources. Because we've seen, especially during the pandemic, we've seen a lot of like maximum capacity. We've seen like even with the NHS, National Healthcare Service, we've seen that there's an overburden on the healthcare system, even in the US and the UK, in so many healthcare systems, there was an overburden. So digital health, in this case, any form of technology would help. So what are your thoughts? Like what's your initial take on this? Do you think that the world should go more digital?
Yes. I mean, I think the way you said it, it offers, I think you're putting health into also like the patient's hands is empowering, and it also builds trust with medical practitioners. So I think in that way it's really useful. But when considering like expanding it, especially for the aging population, the first thing that came to my mind is, we talk about equitable health is making it accessible. So, you can have these great ideas and the apps can be available, but they need to actually reach the population you wanted to. And what I was reading earlier on was a lot of places where the aging population live, not even just because people assume developing countries are the problem, but even in places like the US, simple things like the internet, Wi-Fi are not available. No. So people don't even have access to the internet in order to be to benefit from digital health. So when considering this, I think it's also important to build infrastructures to support it.
Yes.
And consider these groups and acknowledge that they also need access to these services. So, but I think it can be the future. I mean, I think it has a lot of potential.
Yeah. Excellent. Yeah.
Yeah, 100% agree with Loza there. I think that's a really good point about like actually having access and like ensuring people have the infrastructure, because if you don't have it, then what was the point?
Right.
And yeah, I think, there's various solutions people have in terms of, I've seen things like, instead of relying on like internet and stuff like that, they somehow take advantage of radio waves in order to transmit information and that kind of stuff. So there's solutions that, So there's innovation, and that's why I think as well, definitely we can use more of like digital health and all these technologies.
Excellent.
Yes.
Yes, we're in agreement.
We all agree for once. I'm joking about that.
We need to talk after.
No, don't bring shade.
After.
But with digital health, the beautiful thing about it is that not only does it put the responsibility into the patient's hands, right? So I like to think of health with the 3 R's. I've seen this on a TED Talk before, even in some like paper. The 3 R's: responsibility, relationships, and requirements. So the responsibility is like, what can I as a patient do to make my healthcare better? What can I do? Am I taking my medication on time? Am I basically, am I being compliant with what I'm supposed to do?
Mhm.
And there's like relationships, like who is holding me accountable? I know this guy called, I think his name is Marcus, I forgot his last name, but I'll put the name in the description. But he had this app around care aestheticians, and he will talk about how the app eventually, like, it helps patients have those 3 hours, like have, for example, a place where they can track, like, whether they're being compliant, and they can share it with their family, having that relationship aspect, sharing with their family, and saying, for example, like my dad or my mom can see if I've taken my painkillers today, or let's say for me personally, I wear glasses, and every time I go to the doctor, the offer
Ophthalmologist.
the
You've been through
ophthalmologist.
this.
That's a big word for
You've been
Elmo.
through this. Oh,
It's long to pronounce. So long
It
to
is.
pronounce. Ophthalmologist. Whenever I go to ophthalmologist, I don't ever get good news. It's either, oh, my eyesight is the same, or it's gotten worse. I
Yep.
feel bad. I feel alone. I feel like I'm gonna get blind.
Oh.
I'm gonna get blind, but then I'm like, no, like with this whole perspective, we're kind of like empowering patients. Like with someone like me, I could maybe have like a reminder, like once a year, like, have I seen my ophthalmologist? Are my glasses okay? Are they matching my face? Are they, do I need contacts? Do I need eye drops? Do I need this? For example, even like for dentistry, for example, like if you're, have you done your bi-yearly dentist checkup? Have you done
Your cleaning?
Bi-yearly?
cleaning?
Twice a year.
You meant to do it twice a year.
Yeah.
Twice a year to
Mhm.
avoid any those caries,
Yep.
future fillings.
It's
but
true.
but this can be helpful if you had, you know, people that would also be like, yeah, I've done my checkup, you know, it's more of like to empower patients to do it. And that's why digital health comes in place, rather than having being struck at the age of 40 or 50, you're told that you have a stroke, or that you have a huge carrot to take out of your mouth, or you're told that you have, I don't know, like even like your fertility, you're just different things that you could check through apps, right? So with a digital app, like even like an Apple Watch, or the sleep the sleeping tracker, or whatever it is, you can tell how you're progressing. You can track it, oh, how many steps I've done today. I could say, oh, I've done over 1,000 steps, great. Or you could track, oh, my period is not okay. Whereas rather than one day waking up and being told that you have a stroke, or that you have, or you're not healthy, or that your sugar levels are very high, or that you have diabetes, right? Especially when we're in developed countries right now. We're currently all in Europe, right? So we understand that more and more, like, we're more likely to die from things like cancer, diabetes, high blood pressure,
cardiovascular
diseases in general. And this particularly is important in the current day and age where we live in, right?
Yeah.
It's true. And I think, that goes back to like having your health in your own hands, and preventative medicine, which in the long run, I think can save more lives and is probably less costly for the healthcare system and for the person themselves. So I do like that approach of kind of behavioral changes and everything. And to be honest, even like when you look at the biggest risk factors for cardiovascular diseases and everything, it is your behavior, and it's more social determinants than necessarily your genetics or the healthcare that you get once you get sick. The best outcomes are seen based on the person's behaviors. And so having apps that can help you track this is, I think, really good in medicine.
Exactly. Like Jocelyn, you said, if we look to like Europe and many countries these days where we have a lot of people living a very sedentary lifestyle, these lifestyle diseases are becoming more and more common, and therefore, like Loza is saying, it only makes sense that some of these digital, wearables, like the watches, the Fitbits, that can just, give you a good assessment of like your lifestyle, can help in preventing those lifestyle diseases. And I'll say again, I do know as well of like some health insurance companies that try to actually encourage people again to continue living these healthy lifestyles, because it's like you can share the data that comes from your watch or whatever it may be, and then they'll be able to give you like some benefits or some discounts on some stuff, which I think is a great way of like, incentivizing people to like, actually want to like pay attention to their health. So it's like, okay, I better make sure, because the data won't lie. The data won't lie.
Yeah.
No,
I
it's
like
true,
that.
and I think we've talked a lot about like being in high income countries and how uh a lot of well, most of the burden of disease lies in cardiovascular diseases, but also in many like low income countries, like developing countries, like I've seen a lot of cases of like even diabetes. Like my grandfather that passed away from diabetes. We've seen so many cases, even in like in Cameroon where I'm from. I keep saying, we the dishes that we have, we have a lot of vegetable heavy dishes, but we also cook with things like palm oil. Palm oil is not very good for you're getting omega 3 fatty acids from there. Omega 3 fatty acids are not very good for you, and you want omega 6 fatty acids, right, from things like olive oil, right? So knowing that, for example, if I don't know, I know that even in Cameroon, I know a lot of people eventually have obesity, like they're obese, or they eventually have cardiovascular problems later on in life, or somebody just say like, oh, once somebody's uncle father died of a stroke, or somebody's uncle whatever, but they don't understand. Like you just wake up one day, just they'll call it witchcraft, they'll call it something else, without knowing that this is something that could have been prevented from the beginning. So digital healthcare would also be beneficial for these groups, not just like
I think for me it's just the fact that it is true that we, like, people have been reporting there's a bit of like an epidemiological shift you will see in some low-income countries where the expectation is you're like, oh, the infectious diseases, but like the chronic and like non-communicable diseases are also becoming a huge problem. But I think it's like how many people are able to afford like an Apple Watch, you know what I mean? So it's for stuff like that where it's like, yes, there's things we can do. I think, Justin, you pointed out a good thing about like at least having some awareness around like nutrition. Nutrition is an easy thing. It's a part of your lifestyle and all these things, but it's just to be aware of that people may not be able to afford all these wearables that we may have access to and can afford, so that they can keep track of their heart rate all the time. So they can, all these things.
This is why I really, really, really appreciate the importance of mHealth. Now with mHealth, think even like what Apple has done. I always bash Apple, but I love what Apple has done when it comes to like the sleep apps. Even it has information, it has nutritional information. Like if you actually use your Apple, if you have an iPhone,
an Apple.
you have an iPhone, you can actually check, you can check what you've been eating. You can input those things in there.
It's like an all-in-one.
Now I understand that in a lot of developing countries, not everybody has an iPhone, but in the healthcare system, if they can have even any mobile device where they can send out that information to their patients, I know most people they have phones. Like most people have at least, it doesn't have an iPhone, but at least a phone. You can send information, a regular check. The way I got back my vaccination, I got the reminder. I got a text from the GP saying, oh, get your first dose, get your second dose, get your third dose. It could be the same thing of like, if you have your GP or your nurse could send like, reminders or whatever, like how are you doing, like checkups or whatever. But I think
it's true. I think digital health is like, it comes in different forms and it can be adapted to the needs of different countries. So like I said, I think it is possible.
100%. And it is like, I guess as we're discussing now, we can see that it's about digital health, but also just taking advantage of technology, because technology can then be used to promote health, like we're saying here. I'm pretty sure, Justin, you were telling me about some organization where they would make medical films and stuff like that, and then they'd send them to people via like a text message. So that everyone would just receive it for free, like just a free promotional thing, informing people, I think, about like malaria and all these different things. Because like you said, many people have phones these days. So
The charity is a global media charity, and they produce really, really excellent films. Informing, basically, it's particularly made for low and middle income countries because they tend to need it the most in terms for information accessing, also for accessibility reasons. But I think it's been very, very effective. Like it's although not only has it been able to monitor health, but also address misconceptions, address social misconceptions that eventually affect healthcare outcomes, like
Right.
male involvement in antenatal care, for example,
Mhm.
or encouraging having like an illustration or a
Mhm.
graphic or a visual, an audio visual content material thing that would be distributed in a particular village to encourage men to participate in antenatal care visits as well, not just having women show up all the time, but making sure that men are involved as well, for example. And that usually contributes to greater maternity outcomes, like reduced maternal mortality and stuff like that.
Right.
So we've seen very like those are very like good examples that have been used in developing countries as well, not just in developed countries. So
Mhm.
exploit it. And now whilst there's so many advantages, right,
Mm.
to
That's what I was waiting for.
The other side.
with every good thing, there are the downsides. Now, the number one being patient information, the way patient information is being monitored. We have seen a lot of companies or like digital companies or tech companies that would they would provide digital therapeutics in exchange for data. How do we feel about that? Do you think that is it ethical, or is it right, or is it right to request patient information such data in exchange for healthcare services?
Huh. There's so many sides.
So it's like what I come, I say I need treatment for ABCD, and they say, but you need to give us your patient information first, otherwise we won't give you the care.
It's not even like necessarily a treatment. It's more of like, let's say I need this therapeutic I need this service, for example, or I need this app, or I need, for example, let's say that we've seen an increasing use of like virtual reality cardboards. Like virtual reality cardboards can be used, for example, for patients that experience hallucinations or mental health problems. And instead of giving them a drug that could potentially make them dependent on it, they would use virtual reality cardboard, virtual reality to make them kind of like change their, basically like just soothe them and
give them a simulation.
And it will kind of improve their mental health outcomes overall. Now, if the patient now comes and says, "Oh, I need this," say, okay, in exchange for data.
That does not sit well with me personally.
I think, okay, it's interesting because when requesting data or using data, I mean, data is important for research and it helps science advance, great. But when you use someone's data, you need informed consent. Now, consent, when you get consent, for someone to give consent, there needs to be like an option. And in the situation that you gave, it's you don't really have an option. If you want the service, you must give us the data. Is that really consent? In my opinion, no. They didn't really consent. There was more of this is what it comes with, or using the service. So that it doesn't sit well with me. Now, making data, like sharing data, an option, and then you can opt in, is more of an ethical approach, I feel.
Completely agree. If I have the choice, or even if I can say, I can give you my race, age, or whatever it may be, and I'll give you my pre-existing condition, but everything else I won't give you. If I can choose as well, like what I share and what I don't share, then I think it's fine. You have the choice at the end of the day. It's about leaving the choice in the patient's hand.
Right.
But if it's like either you do it or therefore can't use our services, that I don't think is a very good approach.
I like the way you both put it. I think it's the informed consent and the option. The option bit, because you can't blackmail someone,
right? Like it's not consent if you don't have a choice. Consent.
And also, even if you're obtaining consent speaking of consent, if you're obtaining consent, make sure that it's in the language of the people that can understand it. The people can understand the language. Like, don't just be asking things that they don't understand.
Right, wording them in such ways that you don't even know what you're consenting for.
fully informed consent is what we're talking about.
Emphasis on informed.
Exactly. And you know what, like as you're talking about that, it reminds me of like the case I was talking to you guys about this Native American tribe, where at one point, like these researchers came to them and they were like, okay, we're doing this study on like type 2 diabetes. And they did like, they collected their genetic information essentially. And the tribe apparently, like they just did this verbally where they just said like, oh, okay, fine, it's cool. And the consent form that they signed was in English. So again, to your point of like, it should be in a language that people understand, check that first. But then the issue with that was after the study was done, they didn't find anything like really significant there. But then years later, they had stored the genetic information and then they started to use it for a study on like schizophrenia without, you know, getting consent again from the same Native American tribe.
Yeah.
And apparently in that tribe, mental illness and these type of things are very stigmatized. So they took huge offense to that. So it's again, like we're saying, like there should be informed consent because it's not like you can just do whatever you want with someone's data and you can just assume that they'll be okay with it.
Yeah.
Especially like when you're doing a new research with the genetic material of somebody, like you should treat it as if like, okay, you're getting it again. You should go back and ask them, do you consent to this research as well? Like that's a brand new thing that they agreed to.
Exactly.
I don't know how they got away with that one, but
and it's not, it doesn't always have to be like big healthcare innovation projects. Sometimes we see it often even on websites. You go on the website, you want to use a website, they tell you cookies, accept cookies.
And then you have your data.
Like what am I supposed to do with that?
Right?
Exactly. And it's the issue of like when I say yes, I accept all of them, I can't completely say I know exactly what I'm consenting to be honest with you. You know, once I say accept and they have my data, then I don't know what's
it's gone. And sometimes you need to use that website. You have no choice.
And sometimes I mean, I understand that a lot of these companies need data. They need to gain access to the data somehow. But we do need to find more ethical ways to approach it. Like I said before, like having that option to be like, okay, in return, can we also have this? And also, you don't need everyone's data.
You don't need all of them.
You don't need listen, we've done research before. We are aware that there's a way to calculate sample size. There's a way to calculate sample size. There's based on your research. Don't be greedy. You don't need, because you're gonna say, oh, these people don't understand. We just need data. How are we gonna produce the stuff if we don't have data? But I'm like, get your estimated sample size, go and do the mathematics, calculate it, and then find out how much you can get and find a way to do it in an ethical way. You don't have to blackmail everybody to give you data.
Or trick people.
Yeah. It's quite misleading. It's very misleading.
And then it creates mistrust because then information comes out later on. Oh yeah, your data is being used like this.
Exactly. We've seen so many cases where people were like, oh, you know what, the government is using our data through WhatsApp. Oh, we've seen the government is trying to come for us, trying to collect our data on these websites. They won't trust you, and with good reason.
Good reason.
So we definitely have to be transparent about how you do, and we understand that managing it can be difficult. Like managing information can be difficult, and I'm going to refer back to the whole app idea, the app that kind of helps you put everything in one place, especially in the time where you can say, oh, my doctor in Australia told me that, oh, this medication will be good for me, but then my doctor in England told me that no, it is not. Now they have a patient that doesn't trust any healthcare professional, whereas on digital healthcare, if you had it in one place, then you can actually see if there has been any mismatches, and people can be held responsible. What you say, like professionals can be held responsible, and also the patient can then choose who they want to share their information with, especially when necessary.
It can also enable communication between healthcare workers and probably help diagnoses better.
Exactly.
Like better diagnosis, better communication, better trust.
Building trust is important.
And I will say as well, I don't know about you guys, I feel like things that are like digital, like they last for so much longer as well. For example, when doctors are asking me about my medical history, I don't remember everything in my medical history. I'm not gonna lie to you. Some things I just have like as in paper or whatever. I don't always have like the paper trail to show you. So I think putting it digital can also help in that sense. Like you're saying, like we now have like a nice way to track all your information.
Yes, exactly. And some countries do have that where, like, all your information is digital, and then you can choose who has access to it. The doctors have access to it, but you also have access to it. And then you can understand your health and yourself better. And I think that's good. I think more countries should adopt that kind of digital system because it kind of makes everything a bit more fluid, and I think promotes better health.
Yeah, I agree. But the other downside of digital health is that sometimes with healthcare professionals, it puts this barrier between the doctors and the patients. For example, we've seen GP consultations being done online in the NHS, and we've heard complaints about it. It's been good because not only does it reduce the capacity, it reduces the burden on the healthcare system, but then also like online, like it's very difficult to it's not always as easy to fully clerk a patient, to fully identify some issues, like especially when it comes to One Health, like holistic healthcare. Like I could be talking to you right now, but I could be having a tremor in my hand. I could be having a tremor on my toe. I could be having a little vibration going on there, but you won't be able to see it by looking at my face. You get
facts. No, that's a good point.
Yeah,
that's a good point. No, because I will say, even for myself, when I was choosing, let's say, like health insurance plans, and here at least there's the option, for example, to actually have like completely like telemedicine as your first like healthcare option. And when I was having to decide, that's what was going through my mind. I was like, well, assessing a patient like over here on Zoom or like whatever is not the same as when the doctor can be there. Sometimes they need to touch, and they need to just like hear things, and they just, like you're saying as well, with like the tremor, like they won't see your whole body or whatever.
Yeah, I think to have a holistic approach to it, it's difficult. I think there's a lot of things you can miss, but I think it depends on the situation. Completely relying on telemedicine I don't think that's feasible. When you go to the doctor, I mean, like there's things it's not just what the patient is telling you, but like, they're assessing you, they're, as you say, like touching and whatever. So there's things that they can miss, but for some cases, I think telemedicine has advantages, like, people that have, can make things accessible, people that have issues going into to see the doctors, like people with disabilities and everything. I think it can make it accessible. I think it's useful like as a first response, but I think you still need to go in for extensive diagnosis. It's a balance. I think both are important.
Essentially, it's a balance. And now we're gonna get into a bit more a dramatic situation. Robotics. Robotics.
You're in these
Imagine that you're in a delivery room. Let's say you're about to give birth. The delivery room, and you wake up, you see a robot in your periphery of your environment.
Don't say that.
No, say what it is. Your vagina.
I'm joking, obviously, but you get my point.
So I wake up, I see that. Did they tell me there was going to be a robot there? Because if they didn't, people are going to prison.
Let's say they when you were signing those forms, they told you that there were like assistive technologies.
Which some robotics are. Like, it's not every day that robotics is like, the Boston Dynamics, the thing that can jump and do flips.
They're so scary.
We do have like, I think, things that are considered assistive technologies already. So if they told me that it's gonna be like assistive technology, I think I'd be okay with that.
As long as they explain. I think we do sensationalize robots, and we're like, they're gonna take over, they're gonna be tearing you up. But I think it already does exist, and sometimes surgeons do use it, like for precision surgeries and everything. And for that, I mean, if it's giving me better health care, but it can't replace a doctor. I think there still needs to be a human there.
Imagine you wake up to just the robot. Oh my, I would scream.
No,
Oh, like there's no doctors in the room.
Just me and a robot.
And a robot
Just looking at each other.
looking at each other.
What if it runs out of battery?
You see a dog, you know the needles or like
I said, what if it runs out of battery? I'm gonna scream right now. No,
Telling you.
I'd have to leave.
Or you just wake up and you just see someone with, you know, the robots with the tools and the knives and the cutting and the
Yeah, actually, when I was looking into this, there's a name for that thing. I think we all see it in TV and movies. It's called like the Da Vinci surgical system. Like it's a whole patented system. It's a real thing.
Wow.
And yeah, it's the one where it has like different functionalities. Like there'll be the surgeon controlling it from like the control deck, and then they'll be able to like see through a camera. They have the 3D thing. It can use like a scalpel or whatever. So, you know, things like that, I feel like we're used to.
Useful.
They're actually robotics. They're not a full like robot that we imagine, but
they're still a human. Yeah,
they're still there. That one I'll be like, I guess they're just controlling it from somewhere else. Or
I mean, I still wouldn't wake up. I wouldn't want to wake up mid-surgery, but you know, I wouldn't mind.
I'm sorry. I know surgery does not require as much patience, understanding, and communication, but please, I do not want to wake up to a robot. Like, I don't care if you can control it very, very well, and you can control it from the other side of the room, in the other room. I personally, I don't know. That makes me a little uncomfortable.
No, okay. What if they were like, okay, we need to like literally do some very precise like surgery, like we need to very much like identify this one nerve in your body, and we need to cut it like precisely. And would you rather like a human do it or a robot?
Did you not go to medical school? You're not doing your knitting and
no, but you know, sometimes
the hands could be shaking. You don't know.
Yeah, but a robot, you know, it'll be like, I don't know, it's programmed to be very precise. It could do, they could do it better. As long as it's not just the robot doing its own thing over here with no
I feel like I get it. I think a robot would probably be more precise.
But I get what you mean. The image is not comforting.
Yeah. I really feel like in this world we're really becoming, I love the digital being the future thing, but we're becoming very, very, very techy. And I don't know, especially for something like a vagina and things that have you don't get two vaginas, you don't get
two vaginas. Can you make that the episode title?
Oh my God.
This is one body. I have one body, and I'm trusting it in a robot's hands. I don't do.
No, but humans make mistakes too. Like,
right?
Come on.
At least I don't know. I just feel like at least with a human being, like a human, I don't think a woman could ever, a robot could ever replace a surgeon. A robot could never replace, not fully, but even like I still think that. I've done some medical, some healthcare placements. I've been in a hospital. I've seen the surgical operation. Sometimes your brain you just need to be human. You just need to, I don't know. There's just some things that robots can't do. And even if you're saying that yes, it's assistive and it's in the other side of the room and you're in a separate room controlling it. What if in the meantime she may need like some oxytocin release, like by touching her, or like I don't know, like something, I don't know. But I just think that
they can.
Yeah, I think maybe like a balance, like a little balance, not having a whole robot in the room. I
think there'll be like an anesthesiologist and stuff.
Yeah.
Yeah, no, I mean, I see the points you're making. I think you're right that when it comes to making decisions while in a surgery room, I would not entrust that to a robot.
Girl, no. What do you mean?
The robot.
What if it just goes battery saver? So power off.
I'll say, well, me too, I'm dying then.
Yeah.
I think I just see the robot as like as an assistant, like as a supplementary. And I think that's a lot of things with digital health. Like I think the human component will always be central.
Yeah.
And as a healthcare workers, but digital health in terms of robotics or apps, it's just to supplement it. It's just to
complement.
Complement. There we go. That's the word.
Yeah. Or it can help like I don't mind if we have some AI technology that has done its algorithm and it gives like this the suggestion, you know what I mean?
Right.
But it should still be on like a surgeon or some human to like make the final decision, like a call, you know what I mean?
Yeah. No, it's true. We can't replace doctors.
Yeah, you're safe.
Yeah.
The
You're
doctors are
safe out here. Your job will be needed forever. So, any recommendations, any advice that you'd like to give to our fellow Globies when it comes to digital health and managing patient information?
Yeah, it's two big things,
Right.
I'll go first.
Yeah.
Tell us.
So before, when you're processing information, ask yourself the following questions, right? Is it necessary for you to collect and use personal information? And personal, what I mean by personal information, that goes for name, things like a name, age, sex, things that can identify the person. Is it necessary for it to be personal? And then is it necessary to process it in this particular way? And ask, could you use anonymized data instead? Make it anonymous. And then also, are you collecting or processing more data than you actually need? Like Edna, the example that you're referring to. And also, do the advantages of processing this data overweigh or outweigh the costs, the disadvantages? And does processing this allow you to achieve the objective that you initially stated? And could you use less intrusive ways to achieve the same objective? This is particularly important for digital therapeutic companies, or I don't know, in general, like health tech companies that need data. I'm sure you've done your data protection training and stuff like that, but it's always worth remembering and checking.
Yeah. I think I completely agree with all of that. It may, like when it comes to the patient management, managing information, that is where I sometimes take issue with some of these things, because let's say even this Da Vinci surgical system that I'm talking about, it is patented. And so that's the part that has me thinking, like, I would be okay, for example, giving my information away for like to a doctor or something like this, but I think we still have a long way to go in terms of like what we do with data that we give to like private companies that offer what do you call them, digital therapeutics. Yeah, so I think that's a good start. Like those questions that you just asked.
Facts. So I like that. And I think moving away from data privacy, which is important from my perspective, I would say also if digital health is the future, if that's what we're going to use, making it accessible and equitable for everyone. So build the infrastructure so that whatever you're releasing, people can actually use it. And, tailor it for different countries that have different incomes. And I think that's what my advice would be for people that are, in the world, in the space of digital health and developing. I know the Globies are smart. I know they're doing that's what I would say people should look into. To promote equity.
Yeah. Also for like the healthcare practitioners themselves, because I know there are cases, especially in like genetics and genomics, where we're like, oh my gosh, these technologies are going to revolutionize medicine and but it's like we also need to actually make sure our doctors and our healthcare practitioners are ready to receive these technologies and will actually integrate them into their care. So I think that's a key gap that's there between like we have good stuff, but translating it into practice can be a bit slow.
I was reading that the other day, where a lot of doctors in medical school, they're not getting the training on how to, use digital health as a treatment or to suggest it to patients. Usually it's the traditional kind of, prescribed medical products. But I think integrating it is so important because they're some of like the first actors in terms of someone's health. So I agree completely.
Yeah. And also for patients, like Globies around the world. Consider using digital health, more often. Consider actually using the sleep app, sleep tracker. Consider actually reading the information on there about, nutrition, how much protein you should be getting, how many carbs you should be getting. Take advantage of what's made available to you. And also that would help you, that would empower you to take your health into your own hands.
Yes, I'm all about that. I like that.
Yes.
Yeah, on that note, I think we're gonna close.
Yes.
Thank you very much for listening to this episode of the World Health Investigation Podcast. I'm Jocelyn.
I'm Edna.
And I'm Loza.
And we are 3 young global health professionals for the World Health Investigation Podcast. Please follow us on our socials. On Instagram at WHI_podcast. Twitter, WHI_podcast. We have a Facebook and LinkedIn account as well, and World Health Investigation. And please also subscribe to our YouTube channel.
Do it now.
Please.
Right now.
Right this moment. Every day. Does it have to be every day?
Every day.
It must be a struggle.
Some of you are listening and you haven't subscribed yet.
I see you.
Do it.
The mouse is hovering. Just do it.
Dude, I see you hesitating. It's okay. Yeah. Just click it.
That way you're going to get our latest information, our latest episode. You'll be informed about everything you need to know about the World Health Investigation Podcast. Thank you very much for listening and have a lovely rest of the week.
See you